Ever glance at an EKG in a medical drama and think, what are those squiggly lines telling us? I know I have. You asked for a deep dive into EKG interpretation, and we're taking you straight to the source. A fascinating YouTube tutorial by Dr. DrBarai.
It's really quite remarkable when you think about it. EKGs give us this window into the heart's silent electrical signals, you know? It's like we're listening to the heartbeat on a loudspeaker, picking up rhythms and patterns even the most attentive ear couldn't catch.
It's amazing what those lines can tell us. Dr. Barai does a great job of breaking down this complex process in a way that's actually approachable, even if you don't have a medical degree.
Absolutely. His approach really mirrors what cardiologists do in practice, systematically going through each component of the EKG.
He uses this clever analogy with a stopwatch. Remember that? Helps visualize things. Before we get to that, though, maybe let's start with the basics. What are EKGs actually measuring?
Right, so EKGs are essentially measuring the electrical activity of your heart. Not the muscle contractions themselves, but the electrical impulses that actually trigger those contractions.
And what about those leads we see on the EKG? Are those like different microphones positioned around the heart, capturing different angles of the electrical activity?
Exactly. Think of them as different viewpoints rather than the electrodes themselves. We've got the limb leads, which give us a broader perspective, and then the chest leads, which offer a more focused look at specific regions of the heart.
It's like they're strategically placed to eavesdrop on different parts of the heart's electrical conversation.
Precisely. And to really understand how these electrical signals travel through the heart, Dr. Barai uses this really cool animation in his video.
Oh, yeah, I remember that. It starts with the superior vena cava, right?
Yes, the superior and inferior vena cava bring in deoxygenated blood into the right atrium. Then the electrical signal prompts the right atrium to contract, pushing that blood into the right ventricle. And then that signal continues on, telling the right ventricle to contract and pump blood to the lungs to pick up oxygen. That freshly oxygenated blood then enters the left atrium, flows to the left ventricle, and from there, it's pumped out to the rest of the body. It's incredible. And each of these stages, by the way, is reflected in those peaks and valleys we see on EKG waveform.
It's like a perfectly synchronized dance happening inside us all the time, without us even realizing it. And what's fascinating is how directly these electrical signals are linked to the heart's physical pumping action.
Absolutely. With EKGs, we're not just seeing blips on a screen, we're actually witnessing the heart contract and relax in real time.
Okay, so we've got the basic idea of what EKGs are measuring. Now let's dive into Dr. Barai's 9-step method for EKG interpretation. It's like he's giving us the keys to unlock this whole other language.
And like learning any new language, we'll start with the basics. First up is determining the heart rate.
Seems simple enough, right? Just count the beats.
Well, it's a bit more nuanced than that. EKGs actually give us some clever shortcuts. Dr. Barai talks about using those large squares on the EKG grid, remember?
Right.
So, if the rhythm is regular, you can simply count the number of large squares between two R waves. Those are the prominent spikes that represent the ventricular contractions. Divide 300 by that number, and you've got the heart rate.
And what if the rhythm is a little more, say, offbeat, like a jazz solo?
That's where the rhythm strip comes in. That longer view at the bottom of the EKG means you count the number of QRS complexes in that strip and multiply by 6. That'll give you the heart rate.
Clever. So once we got the heart's tempo, step 2 takes us to the rhythm itself, like making sure all the instruments in the band are in sync.
Precisely. We're looking for a nice harmonious relationship between all the different parts of the EKG waveform. Each P wave, which indicates the atria contracting, should be followed by a QRS complex, showing the ventricles doing their job. If there are inconsistencies, it could be a sign of a conduction issue, like a heart block.
Like a skipped beat in the music.
Yeah.
Okay, step 3 sounds a little more abstract. The heart's axis.
Imagine holding a compass up to the heart. The axis basically tells us the heart's electrical orientation within the chest. By analyzing specific leads, we can tell if the electrical activity is leaning more towards the left or right side of the body.
And is one direction better than the other?
It's not really about better or worse. It's more about understanding the heart's position and if it's functioning within a normal range. An abnormal axis can sometimes be a clue to underlying heart conditions.
Makes sense. Now we're getting to the good stuff. Step 4 is the PR interval and PR segment. Sounds kind of like a secret code.
Think of it this way. It's measuring the time it takes for the electrical signal to travel from the atria to those ventricles. The PR interval, that's measured from the beginning of the P wave to the start of the QRS complex. That shows us if there are any delays in this transmission.
So a longer than usual PR interval might indicate a blockage in those electrical pathways.
You got it, like a traffic jam in the heart's electrical system. And the PR segment, that's the flat line between the P wave and QRS complex that can actually hold clues about other conditions. A depressed PR segment, for example, could be a sign of pericarditis.
Okay, I'm taking notes. Now on to step 5, the QRS complex. You called this the gold mine earlier. What makes it so important?
This is where we really zoom in on the ventricles, the heart's powerhouse. We're looking at the width and the shape of the QRS complex. Tells us how effectively those ventricles are being activated. So for instance, a widened QRS complex could point to a blockage in one of the heart's electrical pathways, preventing the signal from reaching parts of the ventricles efficiently.
So it's not just about the ventricles contracting, but how smoothly that contraction is happening.
Exactly. Now, step 6 brings us to the ST segment, a critical area when we're talking about spotting potential heart attack.
Ah, yes, the ST segment. This is the one you always hear about in medical dramas. So what are we looking for here?
Well, the ST segment is the flat line that comes right after the QRS complex. It represents the heart's electrical activity when the ventricles are supposed to be in a relaxed state. If we see this segment abnormally elevated or depressed, that can be a major red flag.
Like a big warning siren going off in the EKG symphony.
You could say that. And there are specific patterns, like the delta sign DrBarai mentions, that can actually help pinpoint the type and location of a heart attack with remarkable accuracy.
Wow, it's incredible how much information is packed into those little lines. Now, step 7 seems a tad more technical. QTC. Are we going to need our calculators out for this one?
It is a calculation, but don't worry, we won't get too deep into the weeds. Basically, QTC represents the corrected QT interval. This measures the time it takes for your ventricles to repolarize. Think of it like this. It's the time it takes for your heart to reset after each beat.
Okay, so why is this measurement so important?
Well, certain medications can actually prolong the QT interval. And that knowledge is really important for doctors because a prolonged QT interval can lead to dangerous heart rhythm abnormalities.
It's like making sure the cure isn't worse than the disease?
Exactly. Doctors have to carefully consider the QTC when prescribing certain medications, especially for patients who might already have a naturally prolonged QT interval.
Another example of why understanding these EKG whispers is so crucial. Now, what about step 8, the ADR lead? DrBarai called it the most neglected lead. Why is that?
It's easy to get caught up in the more dramatic patterns on an EKG, but the AVR lead, even though it's often overlooked, it can actually give us some subtle but really important clues. For example, while ST elevation in other leads often points to a heart attack, in the AVR lead, significant ST elevation could actually indicate something entirely different, like a blockage in the left main coronary artery.
The left main coronary artery, that sounds serious.
It is. It supplies blood to a huge part of the heart, so a blockage there, that's a major medical emergency.
It's like the AVR lead is the quiet observer,
Yeah.
the one who notices the one crucial detail everyone else misses.
Exactly. And then finally we come to step 9, synthesis. This is where a doctor's experience and expertise really come into play.
Right, because it's not just about seeing the patterns in isolation. It's about understanding what they mean for that individual patient.
Exactly. A doctor will take all the information they've gathered from the EKG, combine it with the patient's medical history, their current symptoms, their age, all of it, to arrive at the most accurate diagnosis and treatment plan.
All right, so we've got these 9 steps, but how does it all come together in a real-life scenario? Well, DrBarai actually walks us through an EKG case study in his video, and it's really fascinating to see those steps in action.
Yeah, it's one thing to talk about the individual parts of an EKG, but seeing how they're applied to a real patient, it really highlights the power of this tool.
So tell me about the patient in this case study. What were they experiencing?
The case DrBarai presents is a patient with what's called an inferior STEMI.
Okay, before we go any further, let's decode that a little. What does inferior STEMI actually mean?
Sure. So STEMI stands for est elevation myocardial infarction, which is basically a type of heart attack where one of those major coronary arteries is completely blocked.
Okay, so that's the STEMI part.
Yeah.
And inferior.
Right. Inferior refers to the location of the blockage. In this case, it's affecting the arteries that are supplying blood to the bottom part of the heart.
So if we imagine the heart like a house, an inferior STEMI would be like a blockage in the pipes that specifically supply the basement.
Exactly. And just like that blocked pipe can cause some serious damage to a house, a blocked artery can disrupt that blood flow and really damage the heart muscle.
So how did DrBarai use the EKG in this case? How did he figure out what was going on and what needed to be done?
Well, he systematically went through each of those 9 steps, just like we talked about. He was analyzing the EKG, and he quickly saw that telltale sign of a heart attack, the ST segment elevation. But then here's where it gets really interesting. DrBarai noticed that the ST elevation was actually more pronounced in lead 3 than it was in lead 2.
Okay. Why is that important? Does it change the diagnosis?
It's a subtle clue, but it makes a big difference in how you treat the patient. This particular pattern, along with some other things he saw in the EKG, indicated that the patient was actually experiencing a right ventricular STEMI. So that means a blockage was specifically affecting the right ventricle.
And the right ventricle is the chamber that's responsible for pumping blood to the lungs, right?
Yeah, exactly. And that's why this distinction is so important, because the right ventricle plays this critical role in getting blood to the lungs to be replenished with oxygen.
So what does that mean for treatment? Do you treat a right ventricular STEMI differently than you would a regular heart attack?
You do. And this is where that accurate EKG interpretation becomes absolutely crucial. DrBarai points out that giving nitroglycerin, which is often used to treat heart attacks, would actually be really dangerous in this particular situation. It could cause a big drop in blood pressure, which would make things even worse for the heart.
Wow. So one little detail on the EKG can completely change the course of treatment, potentially even save a life.
Exactly. It really shows you the importance of that accurate interpretation. It's like finding that one missing piece of a puzzle, you know?
Yeah.
The one that helps you see the whole picture.
So for those of us who aren't planning on becoming cardiologists anytime soon, why is it so important for us to understand even the basics of EKGs?
That's such a good question, because even without a medical degree, even a little bit of knowledge about EKGs can empower you to be a better advocate for your own health. Just imagine being able to explain your symptoms to your doctor more clearly, or even recognizing those warning signs in yourself or someone you love.
It's like having a secret decoder ring for your own heart. You can impress your doctor with your EKG knowledge. But seriously, this deep dive has been incredible. We started with those basic squiggly lines, and now we're basically listening to the heart's electrical symphony. We've learned that EKGs, they're not just about diagnosing heart attacks. They give us this amazing window into how the heart works, revealing rhythms and patterns and potential problems.
It's amazing, isn't it? And like with any good deep dive, we're left with even more questions. I mean, what other secrets are hidden in those EKG patterns? Could they help us detect other heart problems earlier on? There's so much more to explore.
Absolutely. And that's the beauty of it all, isn't it? There's always more to learn and discover. So to our listeners, we hope this episode has given you a newfound appreciation for the power of the EKG. But more than that, we hope it sparked your curiosity to keep exploring those mysteries of your own health. Until next time, keep on diving.